There's someone else here. Who let you in? How did that happen? Oh my gosh, jeez. Well, we're gonna let our guests cool in here a little bit. It takes them a couple of minutes. Start chatting. All the while listening to our good friend Paul Melia and the theme song of the Wednesday night webinar. Hold on to the cover. Gotta love it. Paul just sent me his CD, actually. So I'm so excited. It's wonderful. I put it in put it there in the chat for everybody as well. So go onto YouTube, everyone. Check out Paul. Check him out on any kind of your favorite music thing. Let him get his 0.07 cents for 0.007 cents per listen. Probably is what it is. Yeah, we love you, Paul. Hope you're doing well. Hope Paul's well in Ireland over there. All right. Well, Wyatt, Polk, welcome, and thanks for joining tonight. It's so fun to have guests. You know, it's a good time, and I know our listeners can appreciate a good guest too, especially a guest who comes in wanting to talk about his own OCD and treatment. So that's really cool. So we're going to get to you in a second. I just want to announce everyone, welcome once again to Wednesday Night Webinar. Wednesday Night Webinar, a product of NoCD. NoCD, a downloadable app that you can get through Google Play or iOS. You can reach out to us for teletherapy at nocd.com or treatmyocd.com. And you can also click that button right there on the app as well too to be able to do it. We are available in the United States, Canada, the UK, and Australia, and more countries coming, and more insurance is covering as well all the time. So please reach out to us to see how NoCD might be able to help you with your obsessive compulsive disorder and, excitingly, other related conditions, because now we're doing things like BFRBs, trichotillomania, and excoriation or skin picking, and hoarding, and tics. So come on, everyone, reach out to us. Let us give you the help that you need. No need to sit and suffer with something that is treatable. So speaking of treatable, here's a guy who got treatment and reached out to me and said, "Hey, I want to talk about it." I was like, "Okay, why not? Let's do it." Welcome to my basement, Wyatt, and to the Wednesday night webinar. Tell us a little bit about you and what brings you here.
Yeah, thanks for having me. Thanks so much. So again, like Dr. McGrath said, my name is Wyatt. I'm excited to be here, excited to talk about, my experience with NoCD, my experience going through therapy. Maybe I can help someone and just share what I went through and how things have helped me, how things have changed, and kind of what I'm still kind of working on. Because again, it's a day-by-day thing, and I'm just, still just happy to help. So any questions, you guys, please bring them on.
All right. Well, Wyatt, it's a pleasure, and we're going to do what we kind of do. We're going to run through some questions, but I'm going to ask for your opinion as someone who's gone through therapy and NoCD therapy, and also, if any of these questions kind of hit your subtype of OCD or anything, I'd love to get kind of your take on some stuff too, if that's okay.
Absolutely.
All right. Well, Steve says, Dr. McGrath, I know ERP is essential to getting better, but sometimes I just get so anxious I can't take that step forward. What should my mindset be in this case, and what can I do? Well, Steve, first of all, everybody feels a little bit tired or down or just not there on certain days, right? So that's okay. I mean, Wyatt, I'm going to bet that your progression was not like that, right? It was step and then maybe down again and then up again, and then that it's an up and down kind of thing. We don't look for every session is better than the last by any means whatsoever.
Yeah, I agree. I mean, I think that that's something that I had to almost come to terms with. I think that that kind of fall into almost like that emotional reasoning type of situation in which you're really like hoping things feel good before you start. But I've always learned just like you have to dive in. There's never going to be a right time to do the work. And one thing that I actually heard you say a long time ago on one of the webinars, I believe, was like the only thing sometimes worse than doing the ERP or doing the work is not doing it, right? So really just being able to just go like that. Your mindset should just be go. And I know that that's not easy to say. It's way easier to say it, and then have to put two feet in front of the other and do it. But just baby steps, even if it's something really small, that can go a long way.
I kind of stole that phrase from the greatest drummer in the world, Neil Peart, who talked about going out on tour with Rush, and he said the only thing worse than touring is not touring, right? And Therapy is tough. It's grueling, right? I mean, it's no walk in the park. I bet.
Yeah, I honestly did not want to do for the longest time. I was just like, I'm not going to do I need to do this? Do I questioning myself, right? So I'm sure many people can attest to that, and that's just something that's part of it, right? But at the same time, that's what that doubt kind of gets you to want to do. So once you just kind of dive in, I kind of just jump in. Like it really has helped. It helped from day one. Like after you get through that first session, I remember just feeling not really feeling better necessarily, but knowing that I was doing something that was going to ultimately help me, right? And do something that challenged me, which is all I really wanted to do, is challenge myself, challenge, OCD, and just trying to, just take that first step. Honestly, the first session, I was nervous, but after that, it just got easier in terms of being more comfortable talking about things, being more comfortable exposing myself to certain things. Once you put it out there, I think the more you kind of hide things or kind of shelf them away, it becomes more of it's a little bit more difficult to deal with at times.
So, Steve, you're never going to have every day that you're going to feel awesome about therapy, and not every day is going to be the day that you feel you've got the strength to take that step. But as long as the trend is there, Steve, we're doing good. And hopefully over time, that trend gets to be more and more days on and less days off over time as well. Yeah. Afreen says, I've been diagnosed with scrupulosity. However, I find that I'm starting to obsess about my relationships. After virtually every interaction, I go, was I hurtful? Did I intend to hurt them? How can I manage this compulsive feeling to check if I've been rude or did I have malicious intent in my interactions? I always question my intentions. Do I just sit with it? Thanks a bunch. Well, boy. Wyatt, ever questioning any intentions on your part and what you had at all? Or?
Yeah, in the last 5 minutes, or now. So I think that's when I read that. The first thing I thought of, and it sounds maybe too simple in a way, but it's really just maybe don't question them. And I know that sounds like, well, I can, the pink elephant.
Wouldn't that be nice, right? Yeah.
Right.
Wait, hold on. Yep, there it is. Okay. There you go.
Right. But honestly, I think it's that baby step thing. It's like, okay, maybe for 5 minutes, 10 minutes, I'm just going to let that be. I know that sounds maybe for some people too much, but it's baby steps. It's never just going to be all at once. And I think that's what a lot of people try to think, oh, I can't sit with it, but you can. Just give yourself that minute at a time.
Wyatt, this comes up a lot, and I've talked about it from a therapist point of view, but I'm kind of excited we had this question now because it brings up an idea that I have. What does sit with it mean to you as a person who has OCD and who still has to do that at times? How do you define for yourself sit with it?
Yeah, I mean, there's so many resources that I've pulled through, again, OCD, through techniques and strategies to be able to do that. Analogies, things that have helped me that come to mind that allow me, almost in like a repertoire, arsenal, I say, to allow me to gain kind of a perspective and awareness to be like, okay, what does that mean for me? It depends, sometimes we don't want to be triggered, right? Again, right? Why would we? But if we're out in public or whatever the case is, whatever subtype of OCD you may have, that things just happen and pop up. So for me, sitting with it, whether it's just it's just acknowledging maybe a thought, acknowledging maybe a feeling, and just really doing nothing about it. That, again, for me, that's what it is. It's really just, okay, I notice maybe I'm feeling this way, right? Just kind of in my head, or maybe even out loud sometimes. It really depends. And then being like, okay, let me take a step back and kind of ask myself, is this something I really want to go down the path? Because I've gone down that path many times.
Yeah, we know where that path's going, right?
Exactly. Yeah. Or do I want to make a different conscious choice to just kind of just keep moving, and that's usually through action. It's not just going to be like, let me sit with it, and I'm sitting and I'm just like, okay, I'm sitting, and then I'm just kind of thinking, because you just lead to it's more dwelling, right? So it's usually by being active, not avoiding, because the thoughts are going to be there, the feelings are going to be there, but just continuing to do whatever it was you were doing before, whether that's exercise, work, whatever the case is. And I think that's the biggest thing that I've had to deal with, is that feel like, okay, well, it doesn't feel good still, right? So I still don't feel good. But again, learning through action, that's okay, and that you can handle that feeling. So that's kind of my 2 cents of how I go about it.
Can I run something past you, Wyatt?
Yeah.
Was there a point where you came to terms with the idea that sitting with it didn't mean accepting it? It just meant it's just there, and I don't have to believe it to be true or anything. I'm fine with it being there, and I'm gonna be okay with that.
To be honest, I'm glad you asked that, because today was one of the, I'm not, so every day we kind of live with this uncertainty, right? Whether, like, we can't be 100% certain about everything, but what you just said kind of struck a chord, just because that's something I deal with every day. Like, literally, that's something I'm practicing every day, because for me, that acceptance versus agreeing thing, that's something that for me is difficult. But again, I'm learning that every day. But that is exactly right. Like, accepting something, it's like, yeah, I'm accepting that I'm having these feelings. I accept that I'm having these thoughts, and I'm making space for that. And then kind of just continuing on. That is, to me, for myself personally, I'll say 99% of the work.
Yeah. And you can accept something without believing it's true. You could just accept the fact that it's there. I accept that my brain has this image in its head, and now I go back to playing basketball or driving my car or going to work or taking out the trash or whatever it was that I was doing. I'm not going to let that interfere in the experience, right?
Exactly. And for me, I like to even go back at the end of my day and say, hey, like, okay, did I do everything that I wanted to do? Kind of go down my list and make sure, did I like avoid and try away? And then usually, everything gets checked off. And that's exactly what I'm working towards, just continuing to, again, sitting with things, meaning continuing to do the things I want to do, be productive, and just have a great, day or week or whatever it is. And then again, not let those things interfere with that.
Because I think sometimes people fear, all right, I literally have to sit with it, because if I do something, then I'm distracting. But if you're living your life, even though OCD is going on, you're not distracting. You're living your life. You're doing exactly what we want you to do. And that is the definition to me of sitting with it, is being with it and still going on and living the life that I want to live.
Absolutely. I agree.
Awesome. Vanessa says, my therapist is using inference-based therapy. I find this has been really helpful with my sexual orientation OCD. Can you explain this therapy to me a bit more? Thanks. I cannot, because I'm going to have to go look that up. I don't know too much about it, Vanessa. So I'm gonna make a note of that, and I'll check it out and see what we got. Afreen says, one more question. I'm always obsessing about my intentions. Like, did I mean to do that? Did I have secondary motives? This has ruined my life. How can I deal with it? Well, how about this? You already know that OCD is going to throw that at you, but do you have to go down the rabbit hole that it wants you to go? Or can you just recognize it as, oh yeah, everything I do, OCD always says there's probably some secondary motivation for doing it. And I already know that that's going to happen. And I like to say this, and Wyatt, I'm interested again in your reply. I've been saying to patients lately, the way to kind of take the mickey out of OCD, right? The way to pull the rug up from under it is to recognize the predictability of OCD. OCD is incredibly predictable. So for Afreen, it's going to be, no matter what Afreen does, it's going to say, hey, was there a secondary reason for that? Did you have the right intention in doing that? If you already know that's going to happen, do you actually have to pay attention to it and give it any credence? Or could you just recognize that, oh yeah, OCD does that all the time?
Yeah, I mean, that's a lot of that's part of the battle. I mean, again, I know sometimes when you have certain feelings, it just feels like, oh, it's a strain, right? But again, try to just be aware of that and just keep it and keep moving. I know that sounds way sometimes easier, but as what I've learned from my own experience is that as I do keep moving, as I do keep doing whatever it was I'm doing, I end up just feeling better that I did. Honestly, to say the least, like it's a trick, right? The analogy I like is you don't have to take that bait. It's always bait, right? So not taking that bait is a really big first step for a lot of people, but I think that is a lot of the battle, right? Because if you don't take the bait, you can again continue to just thrive in whatever it is you want to do.
Wyatt, did you ever get to a point in questioning and evaluating and thinking, come to a point where your OCD said, oh, well, we've finally gotten an awesome answer. Thank you so much for all that time questioning things. Or was OCD always wanting more from you no matter what?
It always will. That's it will. Yeah, it always will. It always is going to look for more and more and more. It's a losing game. So, OCD has essentially tried to create for many, right, a set of rules in which you cannot win. So the thing is don't play the game. I know that's, again, easier said than done, but that's really what it comes down to, not playing that game. Again, that for other people, whether it's whatever subtype, you have to figure out, strategize with your therapist or whoever it is about what that looks like for you, to not take that bait, to not play that game. But again, that is a lot of the work that no CD can help with.
Yeah. Mike S. says, can OCD affect your sleep patterns and cause you to wake up early in the morning? Can you discuss if this is caused by depression that is a byproduct of OCD? How is it interrelated? And how do you fix or alleviate this issue? Did you have any sleep issues at all, Wyatt, with OCD?
Yeah, I mean, I still sometimes do, to be honest, which is like, whether it's just like, I notice sometimes waking up and just thoughts are just like, maybe in the middle of the night, not like panicked or anything, but just kind of like noticing, because I'm a light sleeper, so things wake me up easily anyway. But and then just kind of go back to sleep. I know that sounds simple, but it has, and not really messed up my sleep pattern. I'm not like waking up early. I'm just an early riser anyway, but I can see how certain stressors and certain things can get to that point, because I can absolutely empathize with that. So. Yeah. Sure.
So, Mike, for a couple of things. Number one, there are some people who might have some dreams that then hold some OCD themes in them, and that might scare them and wake them up, right? So that could be one thing. Depression, we know, does play a role in difficulty with sleeping. It could be falling asleep or staying asleep. That can happen as well, too. There are a couple of things to potentially do. Number one, really work on the OCD, because we have seen this. When people work on their OCD over time, their depression scores go down significantly, even if you're not directly dealing with the depression. So that could be number one. Number two, if you really are having some sleep issues, there you could potentially look at a sleep study to see if there's other things like sleep apnea or things going on. OCD is a stressor, and we know that stressors can lead to things like sleep apnea or difficulty sleeping, because maybe there's an increased blood pressure or various other things going on in the body that could be just a byproduct of all the stress that OCD can bring about. So get a good physical to make sure that there's nothing going on there as well too. Sometimes when people get depressed, they eat more, and they might even gain some weight, or people with OCD might do that because they're afraid to go do things, and so they're kind of stuck inside. And some people use food as a way to kind of self-medicate. They might even eat a lot of carbohydrates, which gives you kind of that rush of serotonin, which then people report feels really, really good. And so there's more sugary types of things. Well, when you do that, that could lead potentially to some weight gain. And what do we know? The weight gain can play a role in sleep apnea and difficulty sleeping as well too. So there's a ton of things that could be interrelated with this. So it never hurts to reach out to someone who specializes on the medical side to say, hey, I'm being treated for OCD. I've also got some of these sleep issues as well too. Anything that you can work on together with my therapist to kind of help me not only address the OCD, but maybe to see if there's some sleep things going on as well. But my first and foremost thing is really work on that OCD, because I think you're going to see depression decrease the more you work on your OCD.
100%.
Daniel, I get why they say it, but it's just not true in my experience with OCD. And can you make your OCD worse? I don't know. I get what they say, but it's just not true in my experience with OCD, and can make your OCD worse. I guess I don't understand where. Maybe I skipped over. Oh, you know what? Never mind. Sorry, Daniel. Sometimes my thing just skips on me and it shot down to the bottom there. So Daniel, we'll get to your question. Emily says, does OCD like to bring up things that happened in the past as proof that the thought must be real? Wyatt, you want to take that one?
Does it? Does it? Yeah. As you said, yeah. I mean, again, not a trigger for me, but just yes. Yeah, I mean, OCD will try to use everything and anything it can to. The analogy I like to use, and maybe others can use this as well, or maybe others have used this as well, is it tries to feed itself. And the goal for me, again, and anybody should be to starve the OCD. It wants to use anything and everything to feed itself, to try to fuel itself, to try to stay relevant in some way. The doubting disorder, right? So I believe, yes, it can try to use anything and everything it can that matters to you, right? Whatever the case is, literally anything that matters to you. You're like, oh, well, maybe no, anything.
Absolutely. Yeah. Anything and everything. Yes, absolutely. And remember this too, in real event OCD doesn't necessarily have the best memory. So it might fill in some details, and they're always the worst case scenario details. Wyatt, this might shock you, but no one's ever showed up to my office and said, Dr. McGrath, I'm afraid everyone loves me and thinks I'm awesome, right? Yeah. I've not treated anyone for that. It's always the bad, awful, horrible, worst case scenario kinds of things.
Yeah, exactly. Yeah, that's exactly what it is. I've heard you say that before, and I think the first time I heard that, it just clicked. Like, wait, I was cracking up because that's so true. it's never going to be, all the greatest things ever, you're a great Samaritan, et cetera, et cetera. No, it's always going to fill in the blank with doubt, right? Some form of that, and whether it's questioning something. So,
absolutely.
Yeah.
Taylor Ann says she loves the SOS videos. Well, thanks, Taylor Ann. I'm so happy. The SOS videos were fun to film. Did you use them, Wyatt, at all?
Yes. Yeah. To be honest, I like to be very transparent. I still have, when things aren't always, the app is a great resource. So I advise anybody who, you can stay connected to the community and just use those if necessary. But again, try not to rely on them, but trying to just do the work that you were really presenting within the video. A lot of people, I think, I don't want to say this for everybody, but I don't want people to use the video to necessarily feel better. I just want to use the content of the video to actually do what you were saying.
Yeah, do that response prevention piece. Yeah, so important. Once again, everyone, tonight's webinar, NoCD sponsored webinar. We're so glad you're here. You can download the NoCD app at Google Play or iOS, and you can reach out to us for teletherapy through the NoCD app as well. And we are in the UK and Canada and the United States and Australia, and we're going to be in more places soon, and it's just so exciting. And tonight, my special guest, Wyatt. Wyatt, thanks for joining. So glad to have you here tonight.
So happy to be here.
Let's get back to some questions. Sherry says, how do I know if I should be worried about COVID or if it's my OCD? Hard to tell the difference. Yeah. Sherry, here's what I say. You follow the guidelines that the CDC puts out, and those are the guidelines that I follow as well, too. And do I have a concern about COVID? Of course. I mean, I think everybody ought to have some concern about it. But we have guidelines that we're told to follow, and so we follow the guidelines, and that's where we go. Now, remember this. Anything beyond that is going to be where OCD wants to take you, right? The 20-second versus 21-second hand wash might be the difference between what the CDC says and what OCD says, right? So just kind of keep those things in mind, that you find your source of truth and don't let it be obsessive compulsive disorder, because OCD is the worst source of truth I've ever seen. Kaylee says, what's up? Hey, Kaylee, good to see you. Hadassah has, what do we got here? What do you know about OCD and eating disorders, especially about how treatment is different? Yeah, well, a couple of great things here. I mean, there are a lot of now eating disorder treatment centers that are moving toward exposure and response prevention, recognizing that people can really be exposed to triggers around food and learn not to be afraid of food, not to use food as their coping strategy, as their safety behavior. It's probably beneficial. We'll have Dr. Nick Farrell on, who's one of our clinical directors here at NoCD, and he also specializes in eating disorders. So I think we could do a pretty good show on that as well. So thanks, Hadassah, for bringing that up, and we'll put that in the list there. All right. Kala says, what are your favorite resources for OCD besides NoCD? Do you have any, Wyatt, that you like?
Yeah, I mean, not necessarily Google and things that people can get caught swept up in, but honestly, the webinars, again, through NoCD, I'm going to say that just because they have helped me so much, I have to admit. And again, watching them for education, to continue to learn strategies, techniques, things to do to help. Also books as well. I like to just kind of read on mindfulness in general and just ways to strategize, again, away from not necessarily even the OCD topic, kind of even away from that, just kind of the broad themes, more things about just mindfulness and things. And then also another doctor who I really admire is Dr. Reed Wilson. He has a lot of great content and information on his website and strategies on his YouTube page as well.
Yep. Shameless self-promotion. I wrote a book called The OCD Answer Book. Might be helpful as well too. So just throwing it out there just in case anyone was looking for a book. But those are great. So thanks. All right. My opinion says, can OCD episodes last for a few hours at a time, like feeling anxious, scared, like something's wrong? But I also have PTSD, and I do tend to notice lasting longer when I approach with an avoidance. Yeah. Well, how long can OCD last for? Why?
Yeah, I mean, so let's be very honest. I woke up this morning, there's things that are still on my mind, maybe from this morning, right?
Okay.
That's okay. Again, that's something that you don't have to necessarily worry about, because again, am I feeling anxious? No, I'm doing a webinar. I'm continuing on with my day. I had a great productive day. I moved things into our new house that my fiance just bought. So things don't have to, I understand that. And that, so long story short, yes, they can last. But again, that to me, almost the way you even phrase that question is kind of like you're checking, you're waiting for almost like things to feel better, maybe, or, in these feelings, so I ask you, maybe, if you're, thanks for acknowledging your feelings, your anxiety. Maybe you said you're feeling a little scared, but what are we going to do about that, right? How are you going to handle that from here on, right? So are you going to sit there and just kind of feel, all right, I'm feeling anxious, I'm feeling scared, or are you going to maybe take that next step and just kind of continue on, as difficult as that may be, to do whatever it is you planned on doing today or tomorrow, or whatever the case is, and really trying to just take that step for yourself.
I lived down south for a while, and I learned a phrase that I love. Fixing to get ready to do something is such a great phrase. And if you're really from the south, you're fitting to get ready to do something, right? And I think, are you fixing to get ready to do ERP, or are you going to do ERP, is really a question that we ought to ask ourselves.
Right.
Yeah. Anonymous 100 says, what do I do if my daughter is resistant to getting help? Well, that is a great question. And, I think that there's a couple of things to take a look at there. Number one, maybe before even starting therapy, maybe watching a webinar like this and just seeing a discussion with people who have OCD, like Wyatt, who have gone through treatment, who can show you that you can come out on the other end and be successful and do well in life. And that might be something right off the bat. Number two, maybe consider support groups, which aren't just therapy, right? But they're just you and a couple of other people to get together talking. We're not psychoanalyzing you or anything like that. We're not putting a treatment plan on you or anything. Maybe those types of things could be helpful. The other thing, though, that I always say to parents is, you got to start working on decreasing the safety behaviors that you're providing to your child. If they're resistant to treatment, that resistance could partially be due to, and I don't know this Anonymous 100, so I don't want to make any assumptions here, but some of that resistance to treatment might be due to the fact that I'm already getting all sorts of things for myself here, and so in getting those things, I would lose out on some of that if I started to do therapy. So maybe some removal of some of those safety behaviors that you're providing could be something that you would do. So we seem to have lost Wyatt. Oh, wait, Wyatt's coming back. Hold on, everybody. He's coming back. There he is again.
Sorry about that.
No worries. Any other things, Wyatt? Ideas on motivation, or were there things that you kind of used for yourself to motivate therapy or something as well?
Just wanting to, it sounds kind of corny, just get my life back. It sounds very just cheesy, but many people understand what that feels like, who just kind of, maybe people in this chat, people, who may watch this. And what I mean by that is just not being afraid to just challenge it for once, right? It's something that I've lived with for a long time. I was younger when I kind of noticed a lot of these tendencies and things. And then honestly, this past year was the first year I really took it seriously. 2020, going in 2020, going into 2021 to really get help for myself. So just being tired of not helping myself and putting myself first in regards to just knowing that this is treatable. This is something that I can work on. And then again, my sister has also been helpful as well, because she's has her PhD and she's just kind of been around me my whole life. She's older than I, and just kind of was motivating me as well. My fiance, just people in my corner who've just been pushing me to think, you know what, you can do this. And I just haven't had to take that first step, which again, I advise anybody who's watching this or will watch this to do for themselves, just because it's something that, again, can change your life and help you, and just really just help you realize you can deal with this, you can handle this, and it's something you can get better from.
Eternal Peace says, I have fear of bodily fluids, and how do I change the core beliefs that I have about them? I think that obviously tough questions, especially if you're talking about, urine or feces or semen or discharges or snot or phlegm or tears, sweat, and any of these things. It's easy to think about how, oh my gosh, what if I got one of these things on me and I was contaminated and then I passed it on to other people? So I think Eternal Peace, you got to look at a few things. What is your source of fear? Is it that these things are dirty and will contaminate you? Is it that these things are dirty and will contaminate other people? Is it that these things are just gross and disgusting in and of themselves, and so I just feel gross and disgusting because of them? And so that would be number one. I'd really want to kind of understand what is the source of fear around them. And then number two, I would want to just take a look at the fact that you are just like the other 8.5 billion people who live on the planet who also produce bodily fluids as well too. I don't know of any bodies out there that don't produce some kind of fluid. Do you, Wyatt? Are you familiar with any?
I don't. I thought about it, but I don't.
I was thinking, Wyatt, you said your fiance is a dentist. There's a lot of fluids going on. There's drool and spit and phlegm and snot and sneeze and all sorts of things that she must be dealing with all the time, right?
All the time. Honestly.
All the time.
Yeah, I hear about it sometimes. It's a lot.
So, pus. We forgot pus and blood and other oozy lymph kinds of things as well too. Now, let's be honest. Could these fluids carry something that could be dangerous? Sure. Absolutely, 100%. I'm not lying here to anybody. They absolutely could. But eternal peace, I'm wondering, if you're afraid of your own kind of fluids, what could your own fluids do to you that they haven't done already, since they've already been inside of you? Now they've just maybe come outside of you, but whether they're inside or outside, they're equally the same, right? It doesn't matter. They don't do anything new. And also, eternal peace, if those fluids are not harming you, how could they potentially harm somebody else if they're not being harmful to you? So think about that question. And then number three, let's talk about, but I'm afraid of other people's bodily fluids. And you know what? I think about working at a hospital. We had something called standard precautions. And standard precautions for a hospital means we make an assumption that every person who walks in the hospital has some kind of communicable disease. And so we do standard things, like we wash our hands after we go to the bathroom, right? And if we blow our nose or something like that, there are certain things that we do. And there's certain safety precautions that we have. If we're drawing blood, we put gloves on. If we're collecting specimens, we put gloves on. If we're taking a temperature or a measurement on somebody, we have gloves on. And then we go to another person, we change to a different pair of gloves. There's all sorts of things that you do at a hospital kind of thing as well. So it also depends on where do you work and what kind of precautions are you there. There's so many things that just go into this very simple, basic kind of question. But the reality of it is this. It could be a fluid. It could be anything. OCD is going to pick on something and be afraid of it. And it's going to give it meaning that it tells you is true, which you don't actually know is true because you're listening to OCD and you're not listening to an actual source of truth. Mm. Any other thing on that, Wyatt, you would throw in? Or?
No. I mean, you really hit the nail on the head on that one. That's nothing there.
Okay. NM says, I have ROCD, relationship OCD, and seems to be picking on the feelings of leaving. Is it still ruminating when it feels like I'm not trying to solve it? It seems to just keep on revolving on feelings of leaving. NM, let me ask you a question. Could you ever solve an OCD problem? Is an OCD problem solvable? I don't think it is. Because as of yet, in 21, no, oh my gosh, as of last week, 22 years, I forgot my anniversary of my doctorate degree. 22 years of doing this, and I have not yet found someone at all. I have not yet found someone who has said to me they have solved the OCD issues going on in their head, and to the point where OCD said, thank you for your answer. That was awesome. I'll leave you alone now because you have given me the answer that I want. Wyatt, for you, ever?
Imagine it was that simple. No, I mean, I was thinking, imagine. Again, like you've said before, you and yourself and several of your colleagues wouldn't be deployed if that was the case. And
Yeah.
In a perfect world, yes, but no. I mean, again, what Dr. McGrath said really makes sense. Is have you ever really gotten a good straight answer that really reassures yourself? Again, don't look for that. But from OCD, it's rhetorical. Like, it's not out there, right? So it's really about doing the ERP, doing the work, and kind of breaking down that fear you have there, that core fear there. Yeah.
Similar, a lot of our relationship OCD tonight. Haley says, how can a partner approach their partner with our OCD? Like when I'm having an episode, my boyfriend wants to reassure me, and it's hard to tell him not to. What's the right thing for him to do? Well, Haley, I think the best thing for you to do is, number one, Haley, if you're in therapy, bring him into a session and work that out with the therapist so that you guys can kind of plan, all right, in the future, if I'm in this kind of experience, here's what would be best for you to do. That's what I would say would be number one. Yeah. Number two, you might role play that too. So you might, pretend when you're feeling well to do a role play exercise of that. Because guess what? Your boyfriend might be really anxious about the fact that you're uncomfortable, and he sees it as his boyfriendly duty to do whatever he can to make you feel great. But he doesn't realize that in doing that, he's also making your OCD potentially worse as well too. Right? It's similar to this, and I've used this example before, but I'll use it again. If you were to go and visit a relative who was going through detox, the best thing to do for them, according to them, is to give them alcohol. Mm. And the worst thing to do for them, according to the doctors, is to give them alcohol. So what do? Right? Do you do what's best for the alcoholism and the addiction, or do you do what's best for overcoming the alcoholism and the addiction? And that's one way maybe to explain it to your boyfriend, Haley, is you're thinking you're helping me in those moments, but you're actually helping my OCD. Alpha asks, they recently developed transcranial magnetic stimulation for anxiety. What are your opinions on it? I've seen it be helpful to people, and I know some people who have done it and reported that they've gotten some nice results from it. So I think it's something that bears checking out. The FDA has approved it for OCD now as well too, depending on what kind of helmet you use. So that might be something to look into. Layla June 1 says, how can exposure therapy work for people with just right OCD? What are some examples? Well, Wyatt, I don't know if this was your subtype or you want to throw in on it first, but I'm happy to as well. Mm-hmm.
Yeah, no, I mean, it's not really my subtype necessarily. Okay. I understand that there's sometimes that urge to be just right about things or want to check certain things, and that definitely covers certain things for myself. But again, when it's something that's more physical in that regard, maybe the way something is situated, maybe the way, you checking a paper, whatever the case is, it sounds simple. It sounds maybe too difficult for some, but to just do the opposite, literally just jump and do the opposite for myself. That has worked, whether that's something small or large, just literally saying, I'm just going to do the opposite of that, and just try that, and just take that leap of faith. I know that sounds maybe a little too much for some people sometimes, but that's worked in terms of just help saying, hey, you know what? I feel anxious about this, but I'm just going to keep it moving.
Instead of just right, how about we go for slightly wrong, and we live with the discomfort of slightly wrong.
Exactly. Yeah.
Right. If I feel like I can't go to bed at night unless all of the dishes are put away in the cupboard, leave one saucer out on the counter tonight before you go to bed. Do something slightly wrong and sit with the discomfort of it and learn that you can handle that discomfort. That's the kind of stuff. You don't have to take all your dishes and throw them all over the place, right? You can start with one and build into doing it. When you put the towels away tonight, put one 90 degrees different than all the other towels and leave them in the linen closet that way. When you go to pick up all the dog toys tonight, leave one sitting in the middle of the floor, right? Do everything slightly wrong. Give everything a 97% effort tonight, and just allow yourself to sit with that and learn that you can be okay with it. Now, we're not telling you to become lazy, and we're not saying that you're going to be now a big old slob for the rest of your life. That's not it, right? That's not where we're going. We're just saying learn to live with the fact that once in a while things won't feel exactly the way they're supposed to, and there's nothing wrong with that. Okay? Cool. What exposures are good for rumination? Right? Wyatt, was there some rumination ever in your life, or just constant overthinking things? And what'd you do?
Day to day. No, that's day to day. That's a day to day thing. So that's a good question. I mean, everybody's different. Everybody deals with that differently, or deals with different things that they may ruminate on, different topics. But certain things that I've done, again, are just try to, whether it's something small, just try to refocus my attention again, not avoiding things, but again, for me, staying focused. If I'm set that I know that I'm going to get up and I want to work out and I want to do this and this and that, I'm going to do those things regardless of what thoughts pop up, what feelings pop up, and just allow myself to trust that I can sit with that. Because the more you do that, like Dr. McGrath said a moment ago, and you just learn that you can sit with these things, it can get a little bit easier. And then maybe a little bit easier the next day. So just taking that first step to do things that are maybe a little bit uncomfortable, whether that's, for myself, for example, if things are, if I'm having, so one of my subtypes, I see the question down below anyways, is like harm OCD. And so harmful thoughts, the images are like, pop up. There's nothing, again, OCD is not going to give me that right answer. So I've learned techniques in which I'm just going to allow those thoughts to be there and just continue on. And that's as simple as it has to be with whatever I'm doing.
Yeah, that's great. Thanks. Eliza J says, I've been able to reduce and delay my compulsions, but I'm having a lot of trouble not compulsing at all. I have intrusive thoughts about bad things happening to others all day. Any advice? Oh, well, that sounds familiar to one Wyatt, potentially. Yeah.
Again, that's something I deal with as well. I deal with something similar in my own way. And so that's harm. And one thing I try to do for myself as well is see, okay, you're a compassionate, Eliza J, I'm going to say this, you're a compassionate person, right? You care about things not happening to people. And that's something you should applaud yourself on. Again, OCD will always spin it. OCD will always spin it, but maybe take a step back and say, like, what does that mean about yourself in a way, right? So for myself, I've had to do that as well. And when I've had that kind of awareness about it, it's allowed me to gain that little bit of confidence I need for myself, or just a little bit to just allow those thoughts to say, I'm a good person and I care about others, right? I try to sometimes for myself, do the opposite of what OCD says, like I've mentioned before. So for me, that's showing what you've written out. Because again, that's something I've struggled with, and it just shows that you're a compassionate, caring individual.
OCD does like to pick on things that are important to you, right? Yeah. So that's number one. Number two, if you're having a lot of trouble not compulsing at all, don't beat yourself up over that. I mean, recognize that beating yourself up is just another trick that OCD likes to do to make you feel like crap, right? So learn, hey, I didn't do response prevention that time. What can I do next time to make sure that I do it? What can I do to catch myself when I'm not doing response prevention in the future so that I will go toward response prevention? How do I make sure that works and that I do it that way? And I think that everybody's got to give themselves a little bit of grace in this whole experience. No therapist is going to expect you to 100% of the time to never do a compulsion. We recognize that while that's the goal, we also know that that's a really difficult thing to do. And sometimes you're going to get caught and it's just going to catch you out of the blue. And you're going to be like, oh crap, I did that, darn it. Poopy compulsion. All right, what can I do next time? Or how can I go right now and undo that? Yeah, wow, I just noticed I washed my hands. All right, I'm gonna go and recontaminate my hands right away. Or wow, I just neutralized that thought by saying to myself, what a good person I am. No, I'm gonna go back and sit with that thought again, and I'm just gonna leave it there as I continue on. Say, yeah, you know what? I might run someone over while I'm driving to the store, but I'm not gonna tell myself that no, I'm really a great driver. I'm just gonna sit with that idea. Yeah, that could happen. I could do that. And in doing that, Eliza J, I think that you allow yourself to start a pattern of recognizing that, okay, I see where I missed it, but I'm gonna make up for that miss, and I'm not gonna beat myself up for the miss. I'm gonna make up for the miss, and that's what we want to do.
Yeah, I think a little compassion can go a long way. I think I always say that to my compassion is one of the main ingredients. I think that allowed me to even kind of take the step to do this work, to say, oh, like I'm compassion in regards to like, hey, I care about myself. I'm going to do this work, and that because again, like that, you just said when you said the whole thing about basically OCD wants you to be a punching bag. Yeah.
You said a little, Wyatt. Kaylee asked about you and your OCD and struggle and your story, but I think it's nice also with Jem's question after that, which is what's the best way to have success with therapy, especially between sessions? So, that would, you did that. How did you do that? And what kind of advice can you give other people?
Absolutely. I think that it's staying consistent. I think that's the biggest thing. I know there's a few days and after therapy, sometimes you're maybe riding a high, like, oh, I did some work, or maybe not. Maybe it's the opposite. You're not feeling great about, again, ERP is not the easiest thing, but just staying consistent and realizing having an outcome picture was really important. Like, what matters to me more, right? Do I want to play OCD's game, or do I want to do things that matter to me and be able to just be successful in the things I really care about, right? That's personal to every single person, but staying just consistent and doing ERP daily, literally daily. You mentioned this as well, Dr. McGrath, and I use this technique actually, just in which you basically write down a bunch of different things you think could be useful ERP, writing them on index cards, shuffling them up, and maybe doing one every day. Just again, keep holding yourself accountable. I think can go a long way because again, it's not again, but also noting that, like Dr. McGrath mentioned earlier, it's not going to be this linear path necessarily with the work. It's going to be this up and down, but that's progress. Progress is not just linear. So again, that compassion element really goes a long way as well. Consistency and compassion.
Awesome, great. Sloan says, I've had OCD for 20 plus years, been diagnosed for 10. Last year, my theme changed from mostly health and perfectionism to relationship OCD, harm, self-harm, and being scared of getting psychosis and schizophrenia. Well, yeah, this can happen, right? I mean, we do see themes change in OCD, so it's not uncommon. Sometimes it just takes a stressor. Maybe it's a news story or something, and then when your OCD goes, oh my gosh, what if that were to happen to you? And suddenly everything you've been worried about up to that day drops because now this thing is now the most important thing in the world, and all that other stuff just pales in comparison suddenly to this thing that I learned about today. Did you ever experience that, Wyatt?
Yes, absolutely. Yep. Yeah, absolutely. Again, as I mentioned, I'm 27 years old now, but I've had OCD for quite a little while. So yes, and yes, in terms of things can change. But again, as mentioned earlier, OCD will try to, again, cling on to things that have relevance to you. And those relevance of things may change throughout your life. So just be aware of that. And the work remains the same. The work is consistent. It's still doing the work to, again, starve the OCD and just, stay consistent with it.
Mm-hmm. Even Jamie says here, hey, Doc, ERP has really helped me with my intrusive thoughts, but now since making progress, sensory motor OCD is showing up. Any suggestions? Yeah, I got one. Apply everything you did to your intrusive thoughts OCD now to sensory motor stuff. Because if it worked there, it's going to work here too. It's not that it only works in one area. ERP works in all areas, but and maybe why you experience this too. Sometimes the new area pops up and you're like, oh my gosh, I have no idea what to do. How do I deal with this? And my answer is always the same way we dealt with everything else so far.
It is. And that's the one thing I was speaking to Jenna about this. Like, the one of the biggest things I've learned just throughout every webinar I've watched, every article of information I've consumed, it really just comes back to the work. It really comes back to ERP. Like, that is the gold standard. There's no way around that, really, if you're wanting to work on your OCD. And that's gonna, whether it's whatever subtype it does. To me, again, OCD is OCD. At the end of the day, it's still going to be that same consistent work and working with a therapist, working to understand how you can apply ERP for yourself and do that work.
Yes, absolutely. Hannah says, can OCD make you touch people or things involuntarily? People always say that you don't act on your thoughts. Well, I think that compulsions can feel very powerful to do, and especially in like the symmetry kind of things. So I would remove the word involuntarily. I mean, I've seen people who were brushed up on this side and then kind of went and followed that person just so they could brush up on the other side of them to get that symmetry feel. And that's actually a very voluntary, it may feel involuntary because you're like, I got to do this, but there's still a voluntary aspect to those compulsions. So my goal, Hannah, my goal would be to make sure that we're doing ERP in session and that you're doing things that feel kind of involuntary to you, to show you though that there is a voluntary aspect, because that's where therapy comes in, is teaching you that it really is kind of on this voluntary side and that you actually can play a role in challenging this and you don't have to give in. So got a lot of hi guys and people talking about their subtypes here. This is really awesome tonight. Jamie says, Dr. McGrath, should I continue doing ERP even when the exposures do not elicit the same level of anxiety as when my OCD was in full swing? How often should we do exposures while in recovery? Every day, Jamie. Thank you for this question. Yes, keep on doing ERP. It's not going to hurt you, right? And it's always going to help kind of keep you on your toes. I got a sign. I don't know if you can. I got a sign hanging on the wall over there. It's up in the corner up there. And it says, do one thing every day that scares you, right? And I think that's so very important for people's recovery, is to consistently do things that are uncomfortable so that you're always in the mindset of exposing yourselves to things that are uncomfortable, so that OCD doesn't wait until you're kind of complacent to be like, oh, by the way, Wyatt, you haven't thought about killing anyone lately. Maybe you should consider that again. It's been a few weeks. Maybe I'll creep back in just to talk to you about that and see how you're doing with it, right? Mm-hmm.
Yeah, I mean, I agree. That's something that I literally have written down for myself. It's what I'm like, the mottos I like to go by is just intentionally seek discomfort. It's something that it's important to me, just for personal growth. I think that growth is on the other side of discomfort, unfortunately. Whether that's in OCD or just in general life, it can sometimes be synonymous, right? But just do, again, what Dr. McGrath said, one thing every day that you know that's uncomfortable or difficult, and it again will continuously show you time and time again that you can show up for yourself and handle it.
Yeah. Jackie says, my son won't come out of his room. What should I do? Well, Jackie, one thing that I've seen people do is you put dinner on a table 3 feet from the door, right? So if you want dinner, you're going to have to come out of your room and have dinner right here in the hallway, right? We'll put a card table up and you can sit in the hallway and have dinner. And then maybe the next night it's 3 feet 1 inch, and the next night it's 3 feet 2 inches. But you're going to have to do that, right? Because, Jackie, what you don't want is somebody who is going to live the rest of their life in their room, right? And keep convincing themselves the only reason they're safe or you're safe from them is because they've stayed in their room, right? You gotta, at some point, you do what you can to entice somebody to come out, right? Now, Jackie, this might even mean a higher level of care as well, too. And if that's the case, maybe there's, it's tough for families, right? Especially in these kinds of situations. But when somebody isn't doing something to care for themselves, sometimes you might have to have an ambulance be involved or something like that to get somebody into a place where they can start doing work like a intensive program or inpatient even, or something like that, to get the step rolling. I would hope it wouldn't have to go there, Jackie, and that's why I'm suggesting you start doing some ERP in the home, and you can use things that are very rewarding to your son. Maybe, you want that new video game? Great, but you're gonna have to play it out here in the hall, right? I'm not bringing anything else to your room. I'm gonna bring it to 3 feet from your room if you want anything else. Some of those types of things. Daniel says, he's talking to Hannah. Yep, a lot of interactions going on between people tonight, so that's really fun. Zola says, I've been struggling with false memory OCD. It's about something that I probably didn't do, but even the slightest possibility that it happened gives me a lot of anxiety. Any tips? Well, thank you. This gives me the notion that, once again, there is a slight possibility that I've run someone over with my car. There's a slight possibility that I have stabbed someone because I've had a knife in my hand at some point. There's a slight possibility I've shot someone. I've shot guns in the past, so maybe there was an errant bullet or something that went flying somewhere and shot somebody. I could think of any bad, awful, horrible thing in the world and consider that there's a slight possibility that I am the cause of it. So, Zala, what I'd like to say is that is no different for you than any other human being in the whole wide world, right? None whatsoever. But OCD says, but I can't accept the fact that there's a slight possibility. Because you know what OCD does, and maybe Wyatt, you've seen this, OCD confuses possibility and probability. And when there's a possibility, OCD says, well, that's 100% probable that you did that then, since it's possible.
Without a doubt, that's the game, right? It makes those set of rules that it's a game you can't win. So that's 100% right what you just said, Dr. McGrath. It's something that you know probably I heard you speaking about that before, and it was one of the first times I've heard it that way. And it just really just opened my eyes to that it's, again, just a losing game. So not playing the game at all really is the way out of that, because
it's really tough, right? And I feel for people, especially, on this false memory piece. I worked with someone who thought maybe they accidentally left drug residue somewhere, and now 25 years later somebody is a drug addict because maybe they touched it and then it fell off of their body or purse onto a table, and they were feeding their child some Cheerios, and the Cheerios absorbed the drug residue, and then that kid ate the Cheerios. They got their first taste of drugs when they were 3, and now they've become a drug addict all because of him. And maybe he should find that child and pay for their lawyer and their treatment and all kinds of things, because what if he was the reason that something happened, right? OCD knows no bounds, and I think that that's important to talk about, and maybe you saw that in your own life, Wyatt, too. The ridiculousness that OCD will go to on things, to everyone else is ridiculous, but to the person with OCD, it's like, that's not ridiculous. That makes some sense to me. That could happen. What if that did happen? I don't want to be a part of that, so I better do anything I possibly can to make sure that that's not the case.
Yeah, it brings that doubt, and it's not going to, that doubt just keeps on going. So again, working with your OCD therapist, or just a therapist in general who you want to work with, who can help you kind of work on these things, would really help, because that's something that has helped me, really, just working through that, because that what you just said, that's very, yes, that's something for myself, especially just really understanding how to not really dive into the content of things as much as just really learning how to sit with feelings, know that I don't have to play that game, and just do the ERP to help myself. That's what's worked.
Yeah. Melissa says, you're amazing, Wyatt. And I got a parentheses, so am I. So, but you're out in the open. I'm just in the parentheses. So congratulations, Wyatt. I'm amazing.
Thank you.
Let's see. Kaylee says, Dr. McGrath, are you sure you don't have OCD? You know OCD more than someone with OCD. I'll tell you what, Kaylee, and I'll say this. I've heard this from Stephen Smith, our CEO, too. The greatest compliment ever to me is though I don't have OCD, I can talk about OCD like I have OCD. And I just find that to be the greatest compliment in the world, that people with OCD feel like I totally understand what is going on in their head. So thank you for that. I appreciate that. Brianna says, I've been doing my exposures, but I've noticed my anxiety has ramped up a bit the last few days. Is this normal after starting ERP? Yeah. Okay, good. It means you're doing it right. I mean, if you're doing ERP and you're feeling great, I'd question what kind of ERP you're doing, right? Hey, Wyatt, try this out. Ooh, that felt good.
After my first session, I remember feeling like, oh gosh, I still remember that feeling. My stomach just, yes, when you said absolutely, it really just kind of, I pictured almost as if like you're in the ocean, and there's kind of like water, and you just kind of like just rub the bottom of the water, and it all rises kind of to the top of the sand. It's kind of like that. It brings all these feelings up, these emotions up, and it really just kind of, it ramps up that anxiety. So I can relate to that. So absolutely.
Yeah. My gosh, we're like 2 minutes out from our end here. Wyatt, some words of inspiration for all of our listeners tonight on what it was like for you to go through therapy. You did it with no CD, which I think is awesome. And what do you keep doing to make yourself be better as well too?
Yeah, words of inspiration. Honestly, guys, if you are just thinking and you kind of really haven't reached out to no CD in terms of taking the next step to do the therapy, please just you should really just take that step, believe in yourself, and just do it. It really is that simple in terms of just making that first initial call. They make you feel super welcome, and just make you feel almost understood right from the get, in terms of what, and then for me, that allowed me to feel even more comfortable in working on selecting a therapist and just working with the team that they have. So that's a great team that everybody has there. It's, they can make you feel welcome. It feels like a little home. So that's my words of advice for reaching out to do the OCD work. And for myself, I just stay consistent. I literally have, again, challenged myself daily, whether that's something small, and I just try to work day to day on just little things, again, with index cards, however I can, to educate myself, especially is to just do the work. It comes back always to ERP. The gold standard is putting yourself in uncomfortable situations and just proving it to yourself that you can handle it.
And what a great interactions everyone had tonight on the app. I was so excited to see everybody supporting each other. That's what we're trying to do here, create a great community and get people with OCD to realize you're not alone, right? You're not alone. There are millions of people who have this ridiculously stupid disorder, and that we're trying to eradicate as much as we can. And we want everyone to realize that we are here to help you as much as we possibly can. So with that, I want to thank everybody for joining us. Paul Melia's back again, woo, with our theme song. So fun. Thank you, everyone, for joining us on our Wednesday night webinar. I appreciate having you here. Wyatt, it was a pleasure meeting you tonight. This was the first time we met. I mean, we've had an email or two, but really, this was just such a pleasure to have you here. If anyone else is ever interested in coming on and talking about your therapy experience, your journey, your work with OCD, we're always happy to have you, and I'd be more than welcome to have you here. So everyone, make it a great week. Do your exposure response prevention therapy. Stop all the reassurance, and don't feed the OCD. Just like you don't feed the pigeons if you're in downtown Chicago, and don't feed the OCD in your head. All right. Have a great night, everybody. See you later.